All right, welcome to another deep dive.
Yeah.
Today we're going to be looking at coding guidelines.
Oh, fun.
Specifically, musculoskeletal surgical procedure coding.
Oh, wow.
Which, if you work in healthcare
Right.
or billing or really anything like that, this is going to be
pretty important.
really important to you.
Yeah.
So we're going to be looking at a document simply titled
Keeping it simple.
Coding Guidelines for Musculoskeletal Surgical Procedures.
Straight to the point.
It's a very dense document.
It is.
So we're going to be
unpacking it
for you today.
Yes.
And
it's like a roadmap.
Yeah, it's kind of like
for all the different
like a library cataloging system for surgeries.
Oh, I like that.
So so we'll just jump right into it.
Let's do it.
Starting with wound exploration.
Okay.
And right off the bat it says, wound exploration includes debridement and foreign body removal, but it excludes things like thoracotomy and laparotomy.
Right.
And this was surprising to me at first.
Yeah, because you think wound exploration, you think anything goes, right?
Yeah, you would think anything involving a wound, right?
Right, but it's really
focused.
Yeah, it's really super focused.
Yeah, on the wound itself.
Yeah.
Not like going into a body cavity.
Yeah, it's not about the larger thing. It's about just that particular wound.
It's like that keyhole surgery, right? Mm-hmm. You're just focused on that one spot.
Exactly, yeah.
Yeah.
So moving on to introduction injections.
Okay.
You need to code by the number and type of joints or muscles involved.
Yeah, that's with the details.
And this is where those small details
really matter.
Really start to matter.
Yeah.
Because you could accidentally, code for a single joint injection when it was actually multiple injections.
Totally. Big difference.
That would
significantly impact reimbursement.
Absolutely.
So
that was a little...
Yeah, little details matter.
Details.
Moving on to instrumentation.
Right.
Did you know that there's a difference between uniplane and multiplane pins?
I did know that, yes.
Okay, well, for our listeners who don't...
Yeah, happy to break it down.
Can you break that down?
Yeah, so uniplane pins... They're basically for stabilization in a single plane. Like if you're, fixing a fracture, that's pretty straightforward.
Yeah.
Multiplane pins offer more stability across multiple planes.
Gotcha.
So it's like for more complex situations.
Like more complex break.
Yeah.
All right. And then we get into grafts implants.
Ooh, grafts and implants.
And this is where it gets kind of interesting.
Yeah.
You have to code separately for each type of graft used.
Okay.
But you cannot use modifiers 62 and 51.
Interesting. Yeah. Those are off limits.
They're completely forbidden in this section.
I think it's because the type of graft is already baked into the code itself. You know what I mean? It's like adding those modifiers would be redundant.
Yeah, it'd be like saying extra.
Exactly.
When it's already implied.
Yeah, we know what you mean.
Yeah. Redundancy.
All right. So moving on to fractures.
Okay.
They're divided up into closed and open.
Makes sense.
Which makes sense.
Yeah.
And for closed fractures, you code based on the treatment type.
Okay.
The initial, cast, and removal are bundled.
Makes sense. Yeah, that's all part of the initial treatment.
That makes sense.
Yeah.
But even within closed fractures,
right.
There's different levels of complexity.
Oh, absolutely.
Yeah.
Yeah, like a simple closed reduction versus one where they have to put in hardware.
Yeah, there's a big difference between those.
Huge difference.
And then open fractures. Okay.
The bone breaks through the skin.
Oh, yeah.
The initial casting and removal are bundled there as well.
Okay.
But you code for the open treatment itself.
Gotcha. Yeah, that makes sense.
So moving on to spine surgery.
All right, spines.
This is where things get really complex.
Yeah.
You're coding by approach, procedure, and D segments.
It's a lot to keep track of.
It's a lot.
Yeah.
So, can you break down why all that detail is necessary?
Yeah. I mean, think about it like building a house, right? You have the foundation, which is like the approach.
Okay.
You got the framework, that's like the procedure.
Right.
And then you have the individual rooms, which are like the segments.
Okay.
So each element adds complexity.
Yeah, that's a good analogy.
And cost to the project.
That makes a lot of sense.
Yeah, so the coding has to reflect that.
All right. And then vertebroplasty augmentation.
Okay.
This seems to bundle bone biopsy and image guidance.
Interesting.
Which is interesting.
Yeah, I guess it's because image guidance is becoming so common.
Right.
In these procedures.
Yeah, it's like having a GPS for your surgery.
Exactly.
Arthrodesis bone grafts.
Oh, okay, back to bone grafts.
We're back to that layered approach, right?
Yeah.
Coding by approach, instrumentation, and levels.
Layers upon layers.
And then we got our old friends, the modifiers are back.
Oh, the modifiers are back.
They're back in action.
Yeah. It's important to remember those.
So how are those playing a role here?
Yeah, so modifiers in this section can indicate things like, if a bone graft was taken from a different site.
Oh, okay.
Like imagine borrowing lumber from one part of the house to fix another.
Right.
You'd need a modifier to show that.
So it's like a further level of detail.
Exactly.
On top of all the other details.
Yeah, it's all about those details. Instrumentation add-ons. This seems a bit more straightforward.
Oh, good.
You use modifier 51 for reinsertion or removal.
Okay.
But you avoid modifier 62. Interesting. Why is that?
I know, right? So why the distinction there?
I believe it's because modifier 62 is used when two surgeons are collaborating on a procedure.
Okay.
Like two chefs in the kitchen.
Right.
But reinsertion or removal is usually a solo job.
Right.
So we use 51.
It's like a single chef situation.
Exactly. Yeah. One chef, one modifier.
All right, so then we get to bunionectomy.
Bunions.
And procedures like synovectomy and capsulotomy are bundled within the main code.
Interesting.
So it seems relatively straightforward.
So all bunions are treated equally?
Well, not exactly.
Okay.
You still need to distinguish between hallux valgus and hallux rigidus.
Of course, different types of bunions.
Yeah, and those have different
that makes sense.
Surgical approaches and therefore different codes.
Got to be specific.
Cast strapping seems pretty straightforward.
Casts and strapping.
Initial application and removals are bundled, but you have to code separately for subsequent applications.
Okay, so the initial one's bundled, but then any after that are separate.
Yeah, so why the separation?
I think it's because the initial application and removal are considered part of the initial treatment.
Okay.
But any subsequent applications are like separate interventions.
So it's like the initial treatment versus ongoing care.
Yeah, exactly. Got to account for that continued care.
Right, diagnostic scopes.
Oh, okay.
These are generally bundled into surgical scopes unless a separate procedure is performed.
Interesting.
So
it's bundled unless there's something extra going on?
Yeah, why that conditional bundling?
Well, think of it like going to the mechanic.
Okay.
If they diagnose a problem and fix it in the same visit, it's all one service.
Right.
But if they just diagnose it and you come back later for the repair, that's a separate service.
Gotcha. So it's like the scope is a supporting character.
Exactly.
Unless it gets its own starring role.
It's all about the context.
Okay. Excisions.
Excisions.
The key factors are complexity and location.
Makes sense.
And thankfully, closures are bundled.
Oh, good. So what stands out to you about excisions?
Yeah, so what stands out to you there?
Well, I think it's important to remember that the location of an excision can really affect the complexity.
Right.
You know, an excision on the face is way different than one on the back.
Yeah.
So the coding needs to reflect that.
It's all about the context again.
Exactly. Location, location, location.
All right, and finally, malunion union.
Yes, the tricky ones.
Yeah, these are for fractures that don't heal properly.
Yeah, like a building project gone wrong.
Exactly.
You got to go back and fix the foundation.
Yeah. So what's the key takeaway here?
I think the main thing is to use the correct codes for these situations.
Right.
Don't use codes meant for acute fractures.
Okay.
These are a whole different ballgame.
It's a whole different thing.
It's a whole different thing.
You got to be precise.
Precision is key.
All right. Well, that was quite a deep dive.
It was a deep dive.
Into the first part.
Yeah, just the first part.
Of musculoskeletal surgical procedure coding.
There's so much more.
And I feel like we just
scratched the surface.
Scratched the surface.
Yeah, we do.
There's so much more to cover.
So much more.
But we'll save that for part 2.
Stay tuned.
So,
yeah,
make sure you join us again next time.
Can't wait.
As we continue our exploration
That's an adventure.
Of this fascinating world of coding.
Exciting stuff.
All right. Until next time.
See you then. Welcome back to our deep dive into musculoskeletal coding.
We're back.
We're back and ready to explore even more coding mysteries.
I feel like we've already learned so much, but I know there's still a lot to uncover.
We've only just scratched the surface, really.
So, where do we go from here? What's next on our coding adventure?
Well, let's talk about something that often causes confusion. The difference between excision and debridement.
Ooh. Yeah. I can see how those two could get mixed up.
They both involve removing tissue, Right.
Yeah, so what's the key difference?
It's all about the purpose and the extent of the removal. Excision is like a targeted removal. You're going after a specific lesion or mass, making sure to get all of it with clear margins.
Okay, so it's like removing a weed by the roots. You got to get it all.
Exactly. You don't want it growing back. Debridement, on the other hand, is more like cleaning up a wound.
Oh.
You're removing dead or damaged tissue to help the wound heal.
So it's less about targeting a specific structure and more about creating a clean environment for healing.
Precisely. And this difference is reflected in the coding, too. Excision codes depend on the size and location of what's being removed, while debridement codes are based on the depth and surface area of the wound.
So the coding mirrors the actual procedure, capturing the specific details.
Exactly. Now let's move on to another crucial aspect of musculoskeletal coding, anatomical modifiers.
More modifiers. All right, bring it on. I'm ready to learn more.
Think of these as the GPS coordinates of the coding world.
Okay, I like that.
They tell us the precise location or structure involved in a procedure.
So they're all about specificity.
Absolutely. Let's start with something simple. Left versus right. When coding for procedures on paired structures, like limbs or joints, you have to specify which side was treated.
Yeah, that's a pretty important detail. You wouldn't want to bill for the wrong side.
Exactly. Anatomical modifiers provide a clear and standardized way to do this. For example, LT means left side, while RT means right side.
It's like labeling each side of the body to avoid confusion.
Precisely. And it gets even more specific. These modifiers can pinpoint locations within a structure. For finger procedures, for instance, we use modifiers to indicate which finger was treated.
Wow, the level of detail is amazing. It's like those Russian nesting dolls. Each layer reveals something even more specific.
That's a great analogy, and this attention to detail is crucial for accurate coding. Now, let's shift gears and talk about something that might seem less exciting, but is equally important. Documentation.
Documentation, the paperwork of the medical world.
It might not be glamorous, but it's the foundation of accurate coding.
So it's like the evidence in our coding detective case.
Exactly. Without clear and thorough documentation, it's impossible to assign the correct codes. When documenting a musculoskeletal procedure, it's vital to include specific information: the diagnosis, the surgical approach, the procedures performed, the instruments used, and any complications encountered.
Wow, that's a lot to keep track of. What's the secret to good documentation?
Be thorough, accurate, and concise. Use clear language, avoid confusing abbreviations, and remember that your documentation is a permanent record of the care provided.
So it's like writing a clear and compelling story that someone else can easily understand.
Precisely. Now, what happens if there's a discrepancy between the documentation and the assigned code?
Ooh, that's a good question. It's like finding a plot hole in our medical mystery. Something doesn't quite add up. What do we do then?
When discrepancies arise, it's crucial to investigate the cause and correct the issue. This might involve reviewing the documentation, consulting with the physician, or contacting the payer for clarification.
So it's like a quality control check, making sure everything aligns.
Precisely. Regular audits are essential for maintaining coding compliance.
I'm starting to see the bigger picture here. Coding isn't just about assigning numbers. It's about accurately representing the complexity of care.
You got it. By understanding the system, we can contribute to a more efficient healthcare system.
This has been an incredible journey so far. What mysteries await us in the next part of our deep dive?
We'll be diving into the fascinating world of arthroscopy coding. Stay tuned.
We're back for the final part of our deep dive into musculoskeletal surgical procedure coding.
That's right. And this time we're focusing on a specific area, arthroscopy coding.
Arthroscopy, that's all about those minimally invasive procedures, right?
Exactly, using tiny cameras and instruments to see inside joints.
It's like exploring a hidden world.
It really is, and the coding system needs to capture all those details.
So, what makes arthroscopy coding so unique?
Well, one key difference is the use of separate codes for the diagnostic and surgical components.
So if a surgeon does a diagnostic arthroscopy and then performs a surgical procedure,
they would both be coded separately.
So it's like billing for both the investigation and the intervention.
Precisely. And then we have our old friends, the modifiers, coming back into play.
I knew they'd return.
They're essential for specifying the exact location being treated.
So they're like a coding GPS guiding us through the joint.
That's a great way to think about it. And remember, modifier Nectus 26 indicates the professional component of the procedure.
The surgeon's expertise.
Exactly. Now, let's talk about some common pitfalls to avoid when coding for arthroscopy.
Okay, I'm all ears.
One frequent mistake is using codes for open procedures when an arthroscopic approach was used.
Right, because the approach makes a big difference in terms of complexity.
Exactly, and the codes need to reflect that. Another common pitfall is forgetting to code for all the procedures performed during the surgery.
So if they repair a torn meniscus during the arthroscopy?
You need a code for both the arthroscopy A and D, the meniscus repair.
Gotcha. Each procedure gets its own code.
Exactly. Now let's shift gears and talk about musculoskeletal injections.
Injections, those can be tricky to code.
They can, but the key is to understand the type of injection, the substance, and the location.
It's like a recipe, the right ingredients in the right place.
Precisely. For example, a corticosteroid injection into the shoulder has a different code than a hyaluronic acid injection into the knee.
So the substance and the location both matter.
Absolutely. They're key factors in determining the correct code.
Well, we've covered a lot of ground in this deep dive into musculoskeletal surgical procedure coding.
We have from wound exploration to spinal fusions to arthroscopy and injections.
It's been quite a journey, but I feel much more confident in this coding landscape now.
That's great to hear. Remember, coding is constantly evolving, so stay curious and keep learning.
Thanks to our expert for guiding us through this intricate world, and to our listeners, thanks for joining us on the deep dive. We'll see you next time for another fascinating exploration.